Behavioral health revenue cycle management is where most treatment centers lose money, not in the clinic, but in the billing office. Treatment centers that treat RCM as just billing leave predictable revenue on the table. The ones that run it as a connected operational system hit their collection targets. This is behavioral health revenue cycle management, from the first benefits check through the last payment posted, and every denial resolved. We will cover what makes behavioral health RCM different, where revenue leaks, and how the right platform connects it end to end. Behavioral health revenue cycle management is the full financial process: verification, authorization, claims, payment posting, and denial management. Billing is one middle step. RCM covers verification, authorization, coding, scrubbing, payment posting, and collections. It starts before a patient arrives and does not end until the last ERA is posted. Treatment centers that do not handle authorizations well see denial rates north of 15%, no matter how clean the billing is. Missed authorizations, expired concurrent reviews, step-downs with no new auth, front-end failures that land as back-end denials. A mature behavioral health RCM stack, wired to the EHR and CRM, will typically take a mid-sized treatment center from 55 to 70 days in AR, down to the 30s. Behavioral health RCM runs on 5 connected workflows. A gap in any one shows up as a denial, a delay, or a write-off. Let us walk through all 5. Workflow 1, verification of benefits, the front-end step that determines whether the rest of the revenue cycle has a chance. A complete behavioral health VOB captures eligibility, copays, deductibles, out-of-pocket maximums, benefit limitations, and carve-out payer rules from organizations like Optum, Carelon, and Magellan. Surfacing policy restrictions and exclusions early prevents denials before a single service is rendered. Workflow 2, prior authorization and utilization review, where behavioral health RCM either works or falls apart. Confirm authorization before admission. Keep it current with concurrent reviews. Every level of care step-down needs a new authorization. Miss it? Get a denial. Behave Health tracks authorized levels of care with days remaining and review dates, surfacing expirations before they become denials. Workflow 3, claims scrubbing and submission, where clinical documentation becomes revenue. Billing starts when the clinical team completes the attendance roster and notes in Behave EHR. No manual re-entry. Claims scrubbing validates each claim against payer-specific rules before submission. The code database covers CPT and HCPCS for therapy, IOP, PHP, residential, and MAT. Workflow 4, denial management and appeals. The most common behavioral health denials: CO197, no authorization; CO50, not medically necessary; CO16, claim lacks information; COB7, provider not certified. Each denial gets a named owner on a 7-day cycle, a root cause classification, and the trend fed back to the team that caused it, so the same denial does not repeat. Workflow 5, reporting and revenue analytics. The weekly RCM dashboard tracks clean claim rate by payer, days in AR by bucket, net collection rate, and unbilled charges older than 48 hours. When CRM, EHR, and RCM share the same data model, reports run in seconds, not a week of spreadsheets. Behavioral health providers face billing challenges that general healthcare practices do not encounter. Mental health services require CPT codes like 90791 and 90837, plus HCPS codes for levels of care, codes generic systems rarely handle correctly. Addiction treatment programs face denials due to missing documentation or pre-auth gaps, particularly for IOP and medication-assisted treatment. Behavioral health billing must meet Medicaid and Medicare guidelines that vary by state, plus carve-out rules from Optum, Carelon, and similar organizations. Generic medical RCM is built for episodic primary care. Behavioral health does not work that way. Behavioral health RCM handles residential per diem rates, group therapy billing, IOP authorization pools, and carve-out rules that diverge from the parent commercial plan. Behave Health is designed to support the full behavioral health revenue cycle, verification through payment, in one connected platform. VOB runs at intake. Auth expirations surface before they become denials. Claims are scrubbed before every submission. Each denial gets a named owner with root cause routing. RCM is included in the Behave Health healthcare provider plan alongside CRM and EHR. No separate billing module to purchase. When verification, authorization, and claims run in one connected platform, denials drop, and collections improve. See it in a 20-minute demo. Book a 20-minute demo at behavehealth.com. See verification, authorization tracking, clean claims, and denial workflows end to end.